Hi, my name's Kyle. I'll be demonstrating a sinus trigger today. The sinus projections are done to show the air and fluid levels. I'll be doing 4 projections, a lateral, a PA axial, a waters, and a SMV. And before I get the patient, I'm going to wipe my bucky down so that way they have a clean surface. Okay, all of these will be done at 40 inches. I have it lined up and detented to the bucky. Everything will be done at 40 inches, and every projection will also be done at suspend respiration. And I'm going to go grab my patient, double ID them, ask for pregnancy, why they're here, and all the necessary information. I'm going to grab my patient now. Taylor Cruz.
Hello.
Hello, my name's Kyle. How are you?
Good, how are you?
I'm good, thank you. Can I get your full name?
Irene De La Cruz.
And your date of birth?
December 17, 1998.
Is there any chance of pregnancy?
No.
Okay, what brings you in today?
About a week ago I fell and I've been having a lot of pressure on my face.
Okay, perfect. Let me get this lead shield on you. You turn around. There you go. Perfect. Go ahead and have a seat facing the bucky. Now I've already orientated my 10 by 12 here. I'm at 40 inches. I'm going to take this at 66 at 12 will be my technique. Alright, go ahead and put your chest into the board. Now here I'm positioning her so that her OML is horizontal and perpendicular to the vertical grid device. And the central ray will enter 1/2 inch to 1 inch posterior to the outer canthi. So I'm going to take this at 66 at 12 with my right marker, indicating that this is a right lateral. X-ray. Alright, so I'm going to run my cassette, put it back in. Okay, go ahead and can you look straight ahead here? There you go. I'm going to keep my right marker. Now for this one, it's a PA axial. Caldwell method. It's not actually an axial per se. There's no tube angle. However, we're going to make a 15-degree angle with the central ray at her OML by using this positioning sponge. Go ahead and place your head there. Okay. I'm going to move you over slightly. I'm going to lift up my bucky. Sorry, my tube. I'm going to move this up a little bit, okay? There you go. I've created a 15-degree angle here, and it will exit at her nasion. Central ray will exit at her nasion. My technique for this would be 70 at 20. Okay? I'm going to go take this. X-ray. Okay. Oops, sorry about that.
It's fine.
Now we're going to do a waters method. Okay, go ahead and put your chin here. There you go. Perfect. Now I'm going to bring back my tube down. Put my right marker. Drop this down a little bit. Just watch your chin. Okay, and for the waters method, I'm creating a 37 degree angle at her OML, and I would take this projection 70 at 20, and the central ray here should exit right at the acanthion. Right marker, 70 at 20. I'm going to take this image, X-ray, okay, run my film, put in a new cassette. Now you can go ahead and get up for this one. We're going to spin you around. So we'll take the apron and we'll put it on the other way, because this time she's going to go ahead and sit down here with your back to the board. I'm going to change out my right marker now. I'm going to put my left marker. So now we're at her left side. And this one's tricky. It's called a SMV. It's a submental vertical projection. So we're going to actually move your chair out just a little bit, because we're going to have to put your neck back. Okay? So you're going to want hyper extension of her neck. I'm going to place the vertex of her head on the back of the board here. You should be able to see her eyebrows and eyelashes when in this position. And I'll explain where the central ray goes here in a second. So go ahead and put your head back, back, and bring your neck out like this. A little more. Tell me if it hurts. You good?
Yes.
Okay. So I can see her eyelashes. And now the central ray, you want the central ray to exit in between the points of her mandible. And you'll want to go, you want your CR to enter 3/4 of an inch anterior to the external auditory meatus. Alright, now I'm going to do this at 70 at 32 will be my technique. X-ray. Alright, that'll conclude today's exam. Did you have any questions?
No, I don't.
Okay, perfect. Thank you. I hope you feel better.
Thank you.
You're welcome. This is our lateral view of our sinus series. Here you'll see the maxillary sinus, ethmoidal sinus, frontal sinus, sphenoidal sinus. You'll see the sella turcica here, superimposed mandibular rami, and superimposed orbital roofs. Here we have our PA axial projection, Caldwell method. You'll see frontal sinuses are clearly displayed, along with the ethmoidal sinuses. Our maxillary sinus, mastoid air cells, and you'll notice that 1/3 of the lower orbit is occupied by the petrous ridges. This is our Waters method. It clearly demonstrates the frontal sinus, ethmoidal sinuses, maxillary sinus, sphenoid sinus here, and mastoid air cells. This is our SMV projection. You'll see this one here displays the vomer and the sphenoid sinus. You can even see part of the pharynx here, which is interesting. You can see the mandible